In this episode, we're talking about the link between chronic inflammation, miscarriage risk, and fertility struggles. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you're going to learn how chronic inflammation can silently interfere with fertility and increase your risk for miscarriage, the common signs of inflammation that most people overlook, and practical strategies to reduce inflammation, support your reproductive health, and create a fertile environment for conception. So let's talk about inflammation. Inflammation is your body's natural response to an injury or infection. It's a survival mechanism, and acute inflammation is healthy and protective. We need it to heal. But when inflammation becomes chronic and unaddressed, it silently disrupts your hormones, ovarian function, sperm health, and even the uterine environment. So, chronic inflammation can stem from a diet high in processed foods or sugar, environmental toxins, having gut imbalances such as a dysbiosis or food sensitivities, chronic stress, and unresolved infections, just to name a few. When your body is in a constant inflammatory state, it can prevent ovulation. It can reduce your egg and sperm quality. It can make the uterine lining more hostile and less receptive. So, of course, it can interfere with implantation. And this is why inflammation is a common hidden factor in both fertility struggles, but also recurrent miscarriage. So here are some signs that chronic inflammation may be affecting your fertility. Number one, frequent digestive issues. Are you experiencing bloating, constipation, diarrhea, or IBS-like symptoms? And honestly, these symptoms don't have to be happening every single day, even if you're experiencing it like a couple days a week or even just a few times a month. This could be a sign that something is going on. Persistent fatigue. If you feel like you're getting 7 to 8 hours of sleep and that it should be good, restful sleep, but you're still feeling tired, then this could be a red flag. If you have any joint or muscle pain, having like unexplained aches or stiffness, and it doesn't have to be in a certain area of the body. It can maybe go from your hands to like your knees to your elbows. It just can go all throughout the body. And then number four, skin issues. Do you have a history of acne, eczema? Do you have some kind of like weird or unknown rashes that have popped up in the past or currently for you? And then, of course, autoimmune markers. So Hashimoto's, positive thyroid antibodies, or unexplained inflammation on labs. And these signs may seem like they're quote unquote common, but that doesn't mean that they're normal. And they could seem minor to you, but overall, it can have a negative effect on your reproductive system. And many women can go undiagnosed because inflammation is almost subtle and it can be confused with a lot of different things. And a lot of times, as women, when we do bring up our concerns to our doctors, our concerns are dismissed. And maybe you're told, oh, yeah, that's just PMS symptoms are normal, or having gas and bloating is just part of getting older, or having aches and pains is part of getting older, right? Like I'm sure we've all heard these at least one time or another. And then maybe your labs are coming back and they're not really painting the full picture. So, how can inflammation lead to miscarriage and also fertility struggles? Chronic inflammation creates an environment that is going to impact your egg development, which if the egg development is affected, that is then going to impact the quality of your corpus luteum, so also impacting your level of progesterone. And all of these things play into each other, basically into the next step necessary for implantation and conception to occur. And it can reduce your embryo quality as well. So even if you're doing IUI or IVF, but you have underlying inflammation that's likely not being addressed, this can reduce your embryo quality. So maybe they retrieved 20 plus eggs, but none of them made it. I have heard this story time and time again, and people are left with no answers as to why this happened, except maybe, quote unquote, your eggs are old, right? It can prevent the uterine lining from becoming receptive and a hospitable environment for the embryo to implant. And it can also trigger immune responses that can attack the embryo as well, which is definitely something that we don't want to happen. Studies have shown that women with elevated inflammatory markers have higher rates of miscarriage and lower success rates with IVF. So it's not just luck of the draw, it's a biological response that can be addressed. So here are some steps that you can take to reduce inflammation and support your fertility. Number one, you can follow an anti-inflammatory diet. So focusing on whole foods, omega-3 fatty acids, colorful vegetables, and anti-inflammatory herbs. There have been a ton of studies on the Mediterranean diet and its benefits for fertility, and it pretty much has a lot of these pillars. Addressing your gut health, right? If you have any gut symptoms, you're going to want to work with a practitioner who can do like a gut microbiome test so you can know what is actually going on inside your body. You can address the dysbiosis. You can address any food sensitivities and chronic infections that you may have going on. Stress management. This is huge. Chronic stress contributes to systemic inflammation. So when you can have daily practices like breath work, meditation, or gentle movement, this is going to help regulate your nervous system. You want to detox your environment. So reduce your exposure to toxins and plastics, personal care products, household cleaning products, even if you use pesticides in your yard. Like all of these things are going to increase your toxin burden on the body. And then, of course, when you have targeted supplementation specific to you. I was just doing a test review today for a client, and we went over her antioxidant assay, which shows antioxidants that are specifically protective for her and her body and her cells, protecting her cells from oxidative stress. So this test shows antioxidants that are highly protective. It shows some that have some protection, and it also shows ones that really don't have any protection. And you want to know what was on that list for her? CoQ10 showed as little protection for her. She had other antioxidants that were going to provide her body with more benefit in terms of oxidative stress. So to recap, chronic inflammation can quietly sabotage your fertility without you even knowing and increase the risk of miscarriage. Signs can include digestive issues, fatigue, joint pain, skin problems, and autoimmune markers. And by addressing your diet, gut health, stress, environment, and targeted supplementation, you can lower inflammation and create a fertile environment for conception. So thank you so much for listening. I hope you have a gorgeous day, and stay tuned for Thursday's episode where we'll uncover an underrated yet powerful fertility supportive nutrient and antioxidant. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive. and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.